Good morning. As you said, my name is Dr. Rohima Miah. I am a psychiatrist in private practice in Raleigh. I consider myself fortunate to call North Carolina my home. I've been here since 1996 when I came here for my residency at the University of North Carolina. And I'm happy to serve the mental health care needs of my fellow citizens. And on this day, honoring human rights, I'm honored to be here among other fighters for social, economic, and racial justice. But I am, however, disappointed that our elected officials have chosen not to put policies in place that center the human rights of our citizens here in this state and in our country. We know that the social determinants of healthcare include many factors, including having safe and secure place to live. It includes having adequate food, and it includes having access to health care. Health care is something utilized by everyone, including our newborn babies and children who need them for our immunizations and our pregnant mothers. It is used by young and old alike for acute and chronic illnesses, most of which are not predictable and are due to no one's fault, just like this life-changing pandemic has illustrated. So I want to talk about what would it be like if healthcare was really treated like a human right. If healthcare was treated like a human right, then patients will not need their profit-driven insurance companies requesting, as I have to deal with every week in my office, prior authorization to pick up needed treatment. This is especially true for some of my patients struggling with addiction. Sometimes they will go to pick up medication-assisted treatment at their pharmacy, and they're told it's going to cost a lot more because their insurance has not given prior authorization. They often become frustrated and discouraged and then immediately dropped out of treatment. And we know this can lead to a loss of lives, as evidenced by the rise in use of opiates and other substances. Treatment should be the norm instead of incarceration, which is where addiction treatment is taking place. When healthcare is a human right, patients will not skip getting needed labs that I order to help evaluate for possible serious illnesses or the adverse effect of medication, because they choose to buy food instead for their family, or at this time of year say, I need to get gifts for my kids at Christmas time. Again, these kind of choices leads to adverse effects and often the loss of life. When healthcare is treated as a human right, then patients will not cancel appointments or stop medication because they lost their job or in between jobs and will not be getting health care at their new job for 90 days or 60 days or 6 months. And sometimes, again, this will worsen their conditions and sometimes lead to the loss of life. When health care is finally treated as a human right, patients will not stay in jobs or relationships that may be causing physical or emotional harm. Often the leading cause of loss of productivity in these jobs, and of course one of the leading causes of PTSD, because these patients fear losing their health care. When health care is a human right, patients will instead seek out treatment long before to help prevent the worst outcome, and preventative care can then become the norm. Instead of only focusing on illness, we can instead focus on well-being. And when healthcare is a human right, the policies and financial resources of our state and our country will truly reflect our value and our commitment to each other. Healthcare is a human right, and improved Medicare for all is the only humane choice. Because we know now more than ever during this pandemic that it's not just about your health or your family's health, but it's about everyone's health in your community. and that it's and we need to have healthcare that has no regard to your employment status, your legal status, and does not discriminate against persons based on their ethnicity, race, or gender identity. That is the only way that we can all truly get through this pandemic and move forward to a society that we want to live in. So I call on all of you and my elected officials to help me take better care of my patients and pass expanded and improved Medicare for all. Thank you.